Hi, everyone, and welcome to our webinar today. Today, we are going to be talking a little bit about out-of-network billing, how OWL can help you with that. And we're doing so through talking to our special guest today. His name is Dr. Vatsal Thakkar. And Vatsal actually runs a wonderful platform called Reimbursify. This is a platform designed to make it easier for both clients and clinicians to manage out-of-network billing and make it easier for people to access mental health services while ensuring they're actually getting reimbursed for that. Vatsal and his business partner, Bill, co-founded the platform in 2018. And today we're going to be going through 10 of the most commonly asked questions about out-of-network billing, how this all works and how to navigate it, and talking to you a little bit about how Reimbursify can work to help you with that as well. All right, so without further ado.
Sounds great, Hilary. Thank you.
Awesome. Great. So I would love to get started. My first question is always learning a little bit more about our guests. And so I would love to start if you could tell me a little bit about your private practice journey.
Sure. So I'm a psychiatrist. I finished my training in 2002, 20 years ago now. It went by like a flash. I didn't necessarily have a strong desire to be in private practice so much as I did a strong desire to run my own business and be my own boss. And until I felt the need to do that, which was several years after, is when I finally opened my own office. And it was in New York City, and I was newly married. And what it came down to was being a salaried psychiatrist in New York City, we couldn't really afford the rent. So I decided to go into private practice, open my own office, and took a lot of pride in it. You know, came up with a practice name, a logo, a website, and wanted to deliver a really premium customer experience. And in doing so, I set up and took a few years to build, and I went from there.
That's so fabulous. Thanks for sharing that.
Yeah.
And of course, the purpose today is really that, Vatsal, I would say you're a bit of an expert on out-of-network benefits and how to navigate this as a private practitioner. I'd love for, if our second question, you could explain to me a little bit, do a lot of people have out-of-network benefits?
Yeah, great question. So little known fact, I've probably filed 6,000 out-of-network claims myself. And how that happened is in running my practice, I realized in delivering a good customer experience that the process of people getting reimbursed for having paid for my services was a mess, right? They didn't know if they had benefits. They didn't know what those benefits were if they had them. They didn't know how to access them. And then they didn't know the best way to successfully file and resolve those claims so that they can actually get the money that they were owed. And in the process of first few years of running my practice, I realized this is not really right. You know, this is a legitimate healthcare service that these people who have very, expensive private health insurance and have the benefits are not able to access them. It just never felt right, and at the end of the day, it didn't feel right that the insurance company was just sitting on extra money that wasn't deservedly theirs. And so I took it upon myself to make sure, start asking people if they were actually filing claims. One of the early aha moments I had was I had a patient who worked for a financial services company, had great insurance, money, for healthcare spending should not have been a problem. And yet a few months into treatment, he said he had to stop. And when I asked why, he said, well, it's too costly. And I was really confused because I thought, well, if people who have benefits, surely they access them and they file their own claims and they get reimbursed. But no, that usually doesn't happen. People either don't know about it or don't know how to do it, or it just falls by the wayside. And then they have the daunting task of having to file claims for, dozens of appointments or thousands of dollars. And, some people just give up and say, okay, well, let me find something more cost effective. So that was one of the first aha moments that people aren't regularly getting reimbursed or even seeking reimbursement. And I thought that was a big problem personally and societally. And so I thought, at the very least, let me find out on behalf of my patients who actually has good benefits and who doesn't. And so I would spend time on the phone with insurance companies, and ultimately I had a part-time assistant, and I would hand it off to them. And it was always like a 30-minute or more affair where sometimes we got the right answer and sometimes we didn't. And it was not fruitful. And so we ended up just telling people, you should call yourself. And that's what a lot of people do these days. And that's one of the problems that we at Reimbursify have actually solved for. So now we can deliver someone's out-of-network benefits to either the practitioner or the client or both in about 5 seconds. And I can show you a little bit of that in a minute. So the next step in my practice, I said, okay, if I can't reliably figure out what people's benefits are, why don't I just automate the process of sending in a paper claim for them if they want me to, right? I figured out a way that, there's a standardized healthcare claim form, and we could just use that for everybody. And so I opened it up to, a handful of people. And then I just said, anyone who I'm seeing in this practice, if you want me or my assistant to do that, we will offer that to you. Well, second aha moment was everybody wanted us to file their claims for them. No surprise now in retrospect. And so that led to, we were just routinely mailing things off. We told everyone, well, we're doing this as a courtesy. It's your job to follow up on them. They still kind of kept us in the loop or had customer service issues come back to us instead of when they really needed to call their insurance company, which is another thing that we solve for at Reimbursify. But as we filed a lot of claims, the next aha moment I had, and this one really blew me away, which was when you take away the burden of the reimbursement cycle, it opens up your practice it just makes it thrive. So I basically went from, having a half full schedule. And as a psychiatrist, I don't necessarily see people every week. Some people I see regularly and some people are less frequently. So I always had open slots to fill. And once I started, I put on my website, we will take care of your out-of-network claims for you, even though you pay at the time of the appointment, but we'll make sure that the claims are filed. The practice just blew up. I mean, people literally came in and said, well, I was choosing between you and somebody else, and I read that you're going to file my claims for me, so I chose you. Now, as much as I want them to choose me for my talent, my skill, and my treatment acumen, this is removing friction from someone's administrative hassles is a big deal. And when you're running a business, when you can remove a pain point for your customers, it's a big deal, and you will benefit from that. So that was the 3 aha moments I had in that experience. And I think your question was, how many people actually have out-of-network benefits? And so now I'm ready to answer that question, which is a lot of people in the United States. Here, let me share a slide real quick. So this is a breakdown of how Americans are insured. And about half of the US population is covered through employer-based health plans, which you see on the right-hand side of this graphic. In addition, there are non-group plans, which just means someone's buying their own insurance, or they're a small group or a non-group. And there's also, we have a huge pie of Medicare enrollees in the United States, both the elderly and disabled, and which makes up about 19% of the population. But what most people don't realize is that a third of those individuals have Medicare Advantage plans, which do offer out-of-network benefits. Medicare Advantage plans typically say United, Cigna, Aetna, Blue Cross on them, so they look like private health insurance plans. And so out-of-network benefits are, end up being 150 million people, more than half the population. And when we look at, of those employer-based plans, who has a PPO plan? PPO stands for Preferred Provider Organization. And those are typically the plans that cover out-of-network. The majority of employer plans are PPO plans and do have out-of-network benefits.
That's incredible. I myself had no idea this was so common, because I don't think people talk about out-of-network nearly as much. I think because of the lack of representation for things like Reimbursify, many people can see it as a bit of a barrier, trying to navigate this. And it's really wonderful to see that it is so widely available.
Yeah, and one other point I'd like to make there is that often clients don't connect the dots, and when they think of a practitioner who does not accept insurance, they feel like, or they interpret that as, I'm not allowed to get reimbursed on this. And that is totally incorrect. If you see any licensed, legitimate practitioner for any medical reason, it falls under the umbrella, most likely, most services fall under the umbrella of out-of-network services. And so that's a common misconception on the patient-client side. And then we often run into another common misconception on the practitioner side, which is, I don't take insurance, so I don't need any of your bells and whistles, or I don't need your software. And that's totally incorrect. We built our software for people who do not take insurance to make your life easier. And we adapt to we don't ask you to change your workflow. If all you want to do is give people a super bill and wish them well, we have an option that fits that. And if you want to be more active in your practice and look up benefits and help guide people on out-of-pocket costs and help them actually get reimbursed and file courtesy claims through the practice, like I used to do, we have an option for that.
Yeah, it's so wonderful to hear that you do have different options available for people who kind of can accommodate like different levels of administrative work as well, and different service that they want to offer for their clients. That's so great. All right, so my next question, I know for myself as a client, when I think out of network, I think better options for choice, more likelihood I'm going to find a practitioner who I really love and connect with. But I don't know that I kind of understand the nitty-gritty of it all. So can you give me an explanation of out-of-network benefits and how all of that works?
Sure. So really, there's no difference in an insurance claim, technically, right? Like if somebody bangs into my car, actually, this just recently happened. A garbage truck banged into a retaining wall in my backyard. So how insurance should work? It was the garbage company's insurance plan. I took pictures of the damage. They felt like they didn't need to come and like witness it themselves. The pictures sufficed. So they approved the claim. I got an estimate for the repair, sent it with the pictures. 3 weeks later, I get a check to handle the repairs for the damage that happened, right? This is how insurance should work. Now, that insurance company didn't say, well, are you going to use one of our preferred, construction companies? This is something that is an artifact that's been made up over the last few decades by insurance companies, because they pull people into their network and then they create this coverage division of, well, this is out, we want you to go in network, but you also have out of network coverage, and they've kind of made it a bad word. If you go back 30 years, 40 years, there was much less emphasis on networks. You went, just like the damage I had done in my backyard. You would go to a provider, they were fully licensed and qualified. You would get a receipt, you would send it in, and they would send you a check for the reimbursement according to your plan. And so there's not really much difference. There's a few levers that are set differently on an out-of-network claim versus an in-network claim. So on an in-network claim, the two levers that are most different are this provider will accept what the rate that the insurance company has predetermined, and that payment doesn't go to the insurance subscriber, but it goes to that provider. So those are two levers that are set one in that direction for in-network. And for out-of-network, for every claim that we process, they're set in the other direction. This provider does not accept predetermined rates, and they do not accept assignment, which means they will not accept the direct reimbursement. So that reimbursement needs to go to the individual, the patient, the client, the person who subscribes to that insurance policy. So it's not really rocket science, even though the insurance companies try to make it seem like it.
Yeah, absolutely. When you explain it like that, it does feel so much more simplified. And I guess that kind of leads into my next question, which is, if this is such a, when we boil it down, simple process, what are some of the difficulties of navigating out of network as a client and then also as a provider?
Sure. So let me share my screen again. I outlined some of the difficulties I ran into when I was trying to do this before there was any software to help. Calling insurance companies, filing paper claims, on behalf of people. There was another aha moment I had when I realized that, pardon my language, my patients were getting screwed. Was even though my office was filing all the claims, the rejection rate, the failure rate, I call it, was still around 20%. Now it was around that rate before, meaning that 20% just never got there. The claims just got lost in the mail. And that's, I hate to be cynical, but insurance companies seem to lose a lot of mail. And so that's, some of the challenges on the practitioner side, and we resolve all of those at Reimbursify. But if anyone has ever tried to file their own claim, this is an actual claim form from Cigna. And the one side has the directions on it, and the other side has about 46 fields to fill out. And that form actually only, I think the maximum is 1 or 2 appointments you can put on that one form. So imagine filling this out, 4 times, 5 times a month, or if you do it 3 months at a time, you got to sit down and block off a couple hours to fill this out, make sure you do it right, make sure it's legible, then you put it in the mail, and then you have to make sure that, and hope it gets there, that it doesn't get lost in the mail, quote unquote. But, if you do successfully get the claim into their system for processing, it's really pretty simple how the calculations work. So this is an example of someone who paid $200 for an appointment, and according to their plan, they have out-of-network benefits. Now their plan can say that, well, given where you live and the type of practitioner you saw, we think that they should only be charging $160. And there's nothing we can do about that. This is sort of hard-coded by the insurance company. But what I'll tell you is insurance companies have gotten sued big for making this amount artificially too low. And so what we find is that this number is usually within 10 to 15% of what most people are charging. And so, but let's say that this insurance company for this individual says 160 is what we consider the allowed amount. So that means $40 is the first $40 of the difference there is paid by the patient. And then what this person's plan determines is that the patient's only responsible for 30% of the fee of the 160. And so 30% of 160 is $48. And therefore, at the end of the day, on this $200 appointment, their out-of-pocket is $88, and their reimbursement will be $112. Now, that's still a great reimbursement. An out-of-pocket $88 for a therapy appointment that costs $200 is about we see people who get more than this, and we see people who get less than this. This is a good estimate of an average reimbursement for someone who has good benefits. And the nice thing about getting this topic out in the open and addressing it proactively is that, like that example I gave about one of my former patients who never filed claims for months. If this person can start filing claims immediately, they can satisfy their deductible if it hasn't been already, and they can start getting reimbursed so that they're not constantly out of thousands of dollars out of pocket. Maybe they're out a few $100s, and then the reimbursements start coming in, and so the amount of money that they're floating for their care is much less than it would be otherwise.
That was so helpful. Thanks for sharing that.
Sure. There's one other corollary to that I wanted to, well, I'll save it I'll squeeze it in later. Go ahead.
Sounds great. So my next question for you, you actually alluded to this a little bit earlier, but I'd love to dive a little bit deeper into this. If I, as a practitioner, am saying, I don't take insurance, why do I need to bother with this? I'd really love for you to address that feeling.
Absolutely. So, that's how I started my practice. I was just like, I don't take insurance. I'm not going to help you with it. It's your problem. I mean, that was the message. That's not what I was telling people, but it's not a very inviting message for a mental health practitioner, especially. And then if you compound that with the fact that a significant portion of people who have mental health issues and seek treatment, financial stressors are, usually in the top 3 of one of the stressors that are weighing on them. And so it's important to know about and address this, and not sort of just from a customer service and a business growth perspective, not to be totally hands off. Do your own research. We charge X amount. That's it. It starts off as an antagonistic message when you're trying to get a new client. And then, I helped develop our tools. And I remember when I was in practice, if someone wanted me to do any extra work for any reason, there better be a gosh darn good reason for that, because I a lot of small practices are just well-oiled machines. The workflow is what it is, and that's why we built Reimbursify to kind of match the workflow, a handful of different scenarios, so you can still be hands-off, not add any extra work to your plate, but yet help proactively address out-of-network benefits and reimbursement. And let me share real quick what happens when you do that. So, we'll walk through some of the tools, but 3 ways that Reimbursify helps without adding extra work on the practice end is helping book new first appointments, growing the revenue, because, like that patient I had who dropped out, he never filed reimbursements. I had an empty slot. I had to fill that empty slot with someone new, right? It's turbulence in a practice. And then finally, it increases the satisfaction, that people experience. So like I said earlier, when I started taking care of this for patients and I started getting new clients just based on that, and then they were it was just one aspect of their care that's taken care of, so they can focus on the treatment and getting better. It does, that glow does get sort of assigned to the practitioner, right? That their reimbursements are taken care of. And so, our metrics show that it helps significantly boost new patients who are coming in, knowing their benefits and knowing that their reimbursements will be taken care of. And it also boosts the regular appointments. A lot of us, might have regular, like my wife's a psychologist as well. I'm a psychiatrist, but she has a lot of regular appointments where, once a month, someone might say, well, I have a thing, I can't make it this week. And what happens behind the scenes is that could well be because they just want to cut the expense for that month. Or maybe their car needed repairs and they couldn't afford to do all the weekly therapy sessions that month. And again, getting people on this regular reimbursement cycle, making it easy for them to get reimbursed, whether they file the claim or the practice files courtesy claims, helps get the boost the number of regular visits that are occurring as well.
Yeah, I mean, I can so understand that. I've worked with practitioners myself that do provide more of that kind of administrative assistance in a variety of ways. And you feel that so much as a client. You feel so appreciated and taken care of in a whole new way outside of your sessions, that your practitioner is really willing to go the extra mile to ensure they can make, what's already a difficult process as easy for you as possible in as many ways as possible.
Agreed. Yeah.
Yeah. And I know we may have talked a little bit about this in our last question, but I'm wondering if we have more to add. How does this increase your likelihood of getting new clients?
So one of our best tools that we have is, and this would happen, I think I practiced for 13, 14 years in private practice. And even after, in the 14th year, often the first question when someone's inquiring is, well, I know you don't take insurance, but do you take my insurance? Like, I have really good, just in case, like, right? It's a question that you don't want to not know the answer to. If before you pay someone hundreds of dollars for a service, it's good to make sure that they don't take the insurance. So it's a question that is regularly asked all the time, even when a practitioner's website will say, we don't take any insurance. So one of the things that we help practitioners with is whether the messaging is on the phone or on the website or by email exchange, is instead of having to say, no, we don't take insurance, it's a very negative message in a first exchange. Our software helps you change the conversation to, well, I'm not a member of any insurance plans, but give me your ID number and let's see what your insurance will cover, right? It's a much more open, inviting message, starts the conversation. They give you their date of birth and ID number. And then what our tools help you pull up in just a few seconds is a summary like this. And this can happen by the practitioner or one of their office administrators. It can also be submitted by the client themselves. I'll show you that in a second. But what we see here is that we curate, we get a lot of data back from the insurance company about someone's benefits. And we've built our system to curate that to make it easily digestible and to the client. So we summarize the result here. It says this person has reached their threshold for deductible and will be reimbursed 70% for their next visit. We show you their deductibles here. They have an individual deductible, which they have 0 remaining. So that's why they're going to get reimbursed. Some people also have a family deductible if it's a family plan, but only one of the 2 deductibles has to be fulfilled for the benefits to kick in. And then this plan will cover appointments at 70%. Now, so this is sort of the best case scenario, because you can tell a potential client that you've already met your deductible, and you'll start getting reimbursed. It looks like up to 70%. And like I said earlier, usually those amounts are, within 10 or 20% for most plans. And so we even will show you an estimate, range of dollar amounts based on your fee, to be able to be better communicated.
Well, and I can imagine that's such an instant relief for people right away, already trying to find a practitioner, book an appointment with them. That can all feel like such a hurdle to get over, to then
Right.
have no surprises in terms of how much, is going to be covered and how much you may have to pay out of pocket. Imagine that it's a huge relief to know that right up front versus be shocked later once you already learn you really like the person and want to work with them.
Exactly. And that's the whole, that's one of the big hurdles, right? You get someone in the door, you develop the rapport, and then it's less about, well, is every dollar covered or not? And it's more about like, oh my God, this is the perfect therapist for me. And I'm going to stick with them, even if I get, whether I get the full 70% or just 60% or what have you.
Absolutely.
Yeah, real quick, connected to that, like I said, we also have the option of having the client submit those details directly to the practitioner from a website. So this is an example, a live example of one of our web app. The button that you see in the bottom right corner, it says use your insurance. When someone clicks on that, what happens is that 2 buttons open up, and one of them allows a potential client to verify their benefits or submit a verification, and the other button lets them file a claim directly from your website. So again, they can either use, I'll show you in a minute, we have an app that clients can use to file their claims, but it can also be done from a practitioner's website. And it can also be, courtesy claims can also be filed by the practice themselves. So if they click the verify your benefits button, they would basically submit their email. We added a phone number field. It's not in this graphic. So you will get, this is someone who's new and inquiring through your website using our web app. You'll get their name, you'll get their phone number, you'll get their email address, and you will get their benefits. We don't show the benefits to the client after they fill us out. We validate, make sure it's a real insurance policy, and then the benefits show up in your practice portal. You'll get a notification, obviously, and the little mannequin icon next to John Doe's name indicates that this was submitted by the client. And there's an unread envelope icon next to the date, which means that this is one that's unread. And once you open that, you can share that back with the client, or you can call them. Again, we want to adapt to however a practice is operating and handles those things. We don't want to dictate that this is the only way to interact with your potential client.
Yeah, but it does seem like a really fabulous option to really establish that rapport right away and show clients how you can be so helpful before you might even have a first session with them, and kind of give them a perspective into the customer service that you are going to be offering them in addition to clinical care.
Yeah, no, it's been a big hit. And again, I would have loved this when I was running my practice. I wish the tools existed, but that's why I'm building them for others, because it's been sorely needed.
Yeah. And we've touched on this quite a bit, the customer service aspect of this, or taking a bit of pressure off of them. But why do you think that this is a service as a practitioner, and especially as a mental health practitioner? Why do you think this is important to offer to your clients?
So I think it's reason number one. It's not the only reason, but reason number one is it's just the right thing to do, right? Like the dilemma I faced when I was first running my practice, people aren't getting reimbursed, and the insurance companies are making more money as a result of that. It's just not right. And like I said earlier, a lot of people who seek mental health counseling and treatment, one of the biggest stressors is financial. And so how can we, if we could do something very simple and inexpensively to help not only build a rapport and a bond, but alleviate some of that financial burden and help them navigate it, I think it's a win-win. And then this is not even discussing the fact, the third reason, which is the business case for it. Well, it will grow your practice, right? If there's one person who inquires about, a new client appointment, and you can show them, oh, it looks like you have great benefits, and you can come right in, just getting one new client out of our software tools will pay for an entire year of the software. So it's sort of a no-brainer.
Yeah, absolutely. I completely agree with all of those points. I can imagine it must really help with word of mouth referrals as well. If someone, has a great experience with their therapist, and then on top of that, their therapist helps with their billing, I can imagine that's a huge, huge bonus as well. Sending someone they may know to you.
Yeah, no, absolutely.
Fabulous. Well, I think we've had, enough of the chat back and forth. I would love to see Reimbursify. And I know that you show it from both the client's perspective as well as the practitioner's perspective, but I'd love to see it first from the practitioner's perspective.
Absolutely. Let me share my screen. So I did share a few of these slides already, but we'll walk through from the beginning. So this is how a practice can verify benefits. If, for example, this is done on a phone call, all you need is the name and date of birth, insurance company, and ID number. And once you click the button here, in about 3 to 5 seconds, this summary will appear that you see on the right half of the screen. If you want to see the entire, sometimes it's like 10, 15, 20 screens long response that comes back from an insurance company with every little detail and section, you can scroll down and open that up. But for 90%, 95% of cases, this summary is all people need. The other variations, you will see if someone doesn't have out-of-network benefits, you'll see that if they have an HMO plan, for example. If their plan has elapsed, you will see that. It'll come back and it'll say inactive plan. And so this is really the dashboard to look up the benefits. As I mentioned, our premium plans come with the ability to put this web app on your website to have people submit their own benefits for your review, and then for you to interact with them about setting up an appointment. What happens here is that you can also send a private link. So you could, instead of having this button on your website, I mean, we think it works better on the website because you're going to have visitors who never inquire. Unless they see this button, you're going to get more people inquire, like, oh, let me submit my benefits. But if you get email inquiries, you can also send them a private link that will basically open up this web form for them specific to your practice. And then they can submit their details. And like I mentioned, It will show up in your portal for your review, and then there's a way to share it with and type a specific message as a reply, or call them on the phone number that we will collect for you. I'll go ahead and show the client side of Reimbursify, if that's okay.
Would love that. That would be great. Thank you.
So this is our mobile app. It's available both on Apple and Android app stores. I think we're on the 30th iteration of it. This has been out since 2018. And I will show you a quick video on what that looks like. This is an actual claim filing flow. This is a demo account, but let me see what. So this is a tab in the app where it's viewing the process by insurance. So one of the cool features that we have is a individual client can connect the Reimbursify app to their insurance portal. So everyone has a login now for their insurance portal to look at what's happening, what benefits have been paid out, or what their coverage is if they want to decipher that. But our app will connect your portal directly to the app. So when we see that this visit took place with this practitioner, our app will then tell you when and how much that reimbursement comes through as. So that's a cool automatic status update feature that is not really available anywhere else. And I should add that when that amount comes through from that insurance connection, we also show it to the practitioner in the practitioner's dashboard of how much people are getting reimbursed. But let me play this. We can walk through what it looks like to file a claim from the client side. This is, so these are claims that are sent to insurance. So the first step is to pick the date of service. The next thing we have them do is take a photo of their super bill. And by the way, I should add that we do allow multiple dates at a time. So if a super bill has the whole month's worth of visits on it, you can do that all in one in the same flow. In this example, we're just filing for one appointment. And then this claim is actually ready to go. You see all the clinical details there, the practitioner details. And because this is a Practice Pro subscriber, the claim filing is no charge for the client. They can use the app for all their visits with Brenda Lewis, and they will not have to pay to do that. We do have a pay-per-use option for people who find the app, but their practitioner hasn't heard about Reimbursify yet. And it costs $4 to file a claim per appointment, but it's much more cost effective. We have practitioner plans that are, like I said, a no-brainer. So this claim gets filed. There's that automatic claim status update option. And we give there's a short time frame during which you can cancel a claim if you made a mistake or need to edit the claim. And then we offer this clone option, which is what we just witnessed, which is why all of the claim information for Brenda Lewis was already preloaded in that claim. All the claim filing involved was select the date of service, take a picture of the super bill that corresponds to those dates, and you saw how short and easy that was.
Yeah, so incredibly easy. Much better than that form that you showed earlier with a million fields and instructions.
Exactly. And this is a real life example of what happens when people use our app. So this is, we every so often we get these super users, right? The type of person who's sitting on a bunch of receipts, trying to figure out what to do with them. Maybe they hear about Reimbursify from someone. Maybe they just Google it, like, is there a way I can file my claims? And they download the app. This person filed 24 claims in less than 10 minutes, totaling $5,000 that they were out of pocket. Their deductible was fulfilled, and within a month they were reimbursed almost $2,000.
Wow.
And so you can imagine how we get, feedback like this. This is a real tweet that, we love seeing pop up from time to time. After 10 months of calls to Blue Shield, Reimbursify fixed the mess. So, again, it just feels like it's us against them, unfortunately, with insurance companies. And we love being on this side of the fight, if you will. The other parts of the software, the final thing that I'll share with you is we do offer the ability, and we're the only option in terms of the ability to file courtesy claims where the onus of following up on a claim rests with the client and not with the practitioner. So we have a dashboard where you can see all the claims that have been filed. Even if the client filed it themselves, they will show up here. But you see there's a file a claim button at the top. And what happens, just like in the app, we let you clone the previous claims. And so all that you need to do is to make sure, the codes will all pre-fill from the last appointment. And all the practitioner or admin staff has to do is to enter one or more dates of service. And so you select the dates there, the total being claimed is here, and we're literally 2 clicks away from filing courtesy claims. We've made it faster than even creating a super bill. So when the claim gets filed, practitioners can basically file it and then forget about it. The client gets an email, they can download the Reimbursify app, they can track the claims, and with our premium service, if they have any follow-up claim issues, they will contact Reimbursify and we will take care of that for them instead of the practitioner having to field any of that. So that's Reimbursify in a nutshell. Any of our customers can schedule it's not an email support. It's not, leave a message. You can actually schedule a live Zoom call with someone on our team for any reason right from your portal. So that is Reimbursify, our client-facing and practitioner-facing software in a nutshell.
That's so fabulous. It also is so sleek and nice to look at, which I definitely can appreciate. As someone who spends a lot of my day looking at screens, that's always a really nice facet of that as well.
Yeah, thank you.
All right, so before we hop into, I've seen questions coming in through the chat all throughout this webinar. So before we hop into those, I'd love to just address, I'm sure a lot of people who are watching this are wondering, how can you get started with Reimbursify? And how does this connect with OWL practice? What's the cost of this service? And I'm actually going to field this question. We'll give Vatsal a bit of a break. So the handy little graphic available, which actually shows you this offer that we have. So OWL practice has partnered with Reimbursify. You can see in this graphic that the offer is going to be 50% off to get OWL Pro, which is the top level of OWL, includes all of the features that you could ever want, including, all of the basics like booking, notes, all of that, measures, secure messaging, video therapy, and then also the cost of Reimbursify Pro, which is that plan that Vatsal mentioned, where your clients can use for free. You can have that handy little plugin on your website to help you generate more business and do those real-time verification of benefits as well. So all of that we have as an introductory offer specifically for watching this webinar, available at $75 a month. So if you are interested in taking advantage of this, once you get started with your OWL demo, you can just let your sales rep know that you did watch this webinar and that you're interested in taking advantage of the special 50% off offer, and we'll help guide you through the next steps. I would say it is a fabulous, fabulous opportunity because, as you can see, it's 50% off. The price of Reimbursify is more than just the $75 a month. So you really are getting a fantastic deal here.
Yeah, that's a pretty good deal. I have to say myself, because it's almost a double discount, because there's the combo discount and there's the 50% off. And we have customers who are paying more than 75 a month just for our software, like Hilary said.
Yeah, absolutely. And again, know with that, you get opportunities to white glove training and onboarding into OWL, as well as the customer service that Vatsal mentioned as well. So we're so here for you to help you to get started with your plan and really get started with out-of-network benefits. All right, so I'm just gonna open up our chat here and go through a couple of the questions that have come through. So just give me a moment to pull that up. And it looks like our first one is from Marta. Marta's asking Vatsal, how do I make the move to transitioning to out-of-network?
Great question, and probably a question that every healthcare practitioner in the United States has considered at some point. There's no, first of all, I can't guide someone on the exact steps. What I have told people in general is, if first of all, if I assume that Marta is a mental health treatment provider, so mental health specialists are in demand and short supply everywhere. So, one thing to look at is your market. If she was not a mental health specialist, like, what's how in demand, or how many treatment providers like Marta are in the community. But the more specifics about how to make the move to out of network is, what is how much of a discount are the insurance companies demanding on your fees, right? And one of the easiest ways to kind of dip your toe into out of network is, let's say someone is in network with 4 insurance companies, the big 4: Aetna, Cigna, United, Blue Cross. You can look at which one pays you the worst and maybe start looking at ways to drop that plan. You want to be mindful of, how many clients you have who have that insurance plan, and maybe create a transition plan for them. So maybe you drop out of network, but maybe you only charge them half price for the first 6 months or year for them to continue, while at the same time, again, our tools can be very helpful, because while you're in network with people, you can look up their out-of-network benefits, so you can anticipate who will have a smoother transition paying out of pocket, and who might need more help or more discount as you make that transition. The next important item is to see what your contract says. Sometimes some contract, if usually they renew every year, so you might have to see when your renewal date is. We have seen some insurance companies actually will not let you can drop out of their network, but they will not let you bill one of their clients out of network for a period of time after you leave their network. Like, they don't want you to basically go from, collecting a $20 copay to collecting $200 overnight. And that's understandable, right? It can leave people in a lurch. So you want to look at your contract and see if there's any stipulations like that.
Yeah, that's so helpful. I have our next question all ready to go. So Daniel has asked us, how reliable are your benefit results?
Great question. So the benefit results that come back in our system and let me share the screen again, are exact as they are delivered to us, meaning we are getting the report from the insurance company themselves for this person who has this date of birth, who has this policy number. So everything is correct. Now, I think what, reading into Daniel's question a little further is, and this is a common question we get, is, well, and anyone who's practiced out of network knows that not everyone will get the exact percentage that their plan indicates. And so how accurate is that number? If that's the question, as I mentioned earlier, insurance companies have gotten into big trouble when they, let's say it's a $200 appointment and 70% of 200 is 140. And let's say an insurance company pays someone back $35. Well, insurance companies have gotten into trouble when they did that, because that's not based in reality. And so we see allowable amounts they end up being pretty competitive with what people are actually charging. The exception to that rule is some insurance plans will not use the term allowable amount, or the policy will say it's based on a percentage of Medicare rates. So I know that I personally had a policy like that I was buying myself, where my out-of-network reimbursement was 120% of Medicare rates. And then in that scenario, it doesn't matter what people are charging. The insurance company can just pay 120% of Medicare rates. Now, how do you figure out who has what kind of plan? Let me show you one of our blog topics here, which is, kind of a overview about allowed amounts. And in general, what I just mentioned about, most plans being very close to that actual 70% are typically when the insurance plan is provided by a self-funded employer. Self-funded meaning self-insured. So in America, not to make healthcare even more complicated than it already is, but we have all this private insurance in America, like like one of the slides I showed you, where more than half the population has a PPO plan. The majority of those people are getting their plans through self-insured employers. So it's not Cigna, Aetna, United, Blue Cross who's paying those claims. It's actually their employer. And what happens when the employer is paying those claims is that the whole job, the whole purpose of having health benefits is that you want to keep your employees happy. And that's why we see that the allowable amount is pretty close to what people are charging, because, we've even seen employers who are even more proactive, and they've actually said, well, for mental health, we'll cover 100% of the billed amount. Not even, if you go see a physical therapist for something out of network, we'll pay 70%. But if you see a mental health therapist, we'll pay 100%. So we've seen employers be even more proactive than what the benefit report shows. So I hope that covered all the ways in the reliability question about what our report, the information our report provides.
Saw Daniel in the chat say, yes, thank you. So lovely.
Great.
Okay, next we have a question from Leanne. And Leanne asks, how successful are your claims?
Great question. So one of the initial reasons I thought of Reimbursify as a solution was when we were filing courtesy claims on paper, about 20% would still get lost in the mail, even though we were like printing envelopes like they should not have gotten lost in the mail. So I knew that there was something going on there. And if there was, we wanted to, initially the purpose of Reimbursify was to, the initial purpose, to get claims there reliably, to be able to confirm that they were delivered. And if even after that, if the insurance company said we still don't have it, to easily, with a few clicks, being able to resubmit the claim. And so our claim success rate gets up to 97, 98%. So, you know, in the first pass, we're probably at 94, 95. You know, we get a few extra percentage points because there's some simple things that either, you know, maybe a date of birth was wrong or something, you know, there's something fixable. Maybe the practitioner has to fill out a piece of paper saying, you know, I'm legit, I'm not defrauding the insurance company. And that's a one-time thing that gets the practitioner sort of whitelisted as an out-of-network practitioner in the insurance company's system. But we're in the high 90s for success rates.
That is absolutely amazing to hear. That's such great news. Okay,
Yeah.
I think we have time for one last one, if that's all right with you, before we finish up today.
Sure.
And this question comes from Neil. And this is a great question, I think, Neil, as well. How well do you protect client privacy? Obviously, something really important to all of us.
Yeah, no, that's a great question too. I think it helps that I'm a psychiatrist. So I've had client privacy on my mind since 1998. And in fact, before Reimbursify, I helped consult with a couple of different EHR companies on this very topic, like, because in the US, there's patient privacy, and for mental health, there's an extra layer of privacy on top of that. So being keen to that extra layer, I think, has helped inform my previous endeavors, but also help building this product. So obviously we meet and exceed HIPAA security regulations. But on top of that, every state has their own data security, not necessarily just health related, but just data security. So we meet or exceed all 50 states data security requirements, and we don't do anything with data except use it to provide the service that we advertise. So looking up benefits, filing claims, and resolving claims. There's no, I know there have been other startups of various types in the past that will take health data and then do something, monetize it in some other way. I mean, that is not something that we've even considered. But so we take data security very seriously, and we've passed independent security audits as well. So and we've been around for 5 years, and we keep it top of mind.
That's so wonderful to hear. And I guess just a bonus question for me, is Reimbursify available in all 50 states?
Absolutely. So great question. I usually lead with this. So we Reimbursify works for any private health insurance plan, including Medicare Advantage and even TRICARE, which is not, it's a government-sponsored private-ish health insurance. It works for any type of medical practitioner in any of the 50 states. And we've been doing that since day one. So any state, any practitioner, any private health insurance plan.
That's amazing. Well, I wanted to thank you so much, Vatsal, for being our guest today and really helping us to learn more about out-of-network and really learn more about Reimbursify. I can see so much more clearly now, even after this how wonderful this is for both clients, practitioners, and really how this is the right thing to do to kind of further all of our journeys of making mental wellness more accessible, more available to everyone across the United States. So thank you. And thank you again to all of you for attending today. I really appreciate your engagement in the chat as well as the follow-up questions you had. So thanks so much, everybody, and we'll see you later.
Yep. Thank you.